islands and immunization. For Indonesia, a logistical nightmare. It's the world's largest archipelago, shipping shots to hundreds of millions of citizens spread across more than 17,000 islands.
Actually, taking a public boat is not an ideal condition for distribution of vaccines or drugs. It's just not safe to carry vaccines in crowded conditions.
And the country's vaccination campaign is highly controversial. It prioritizes younger people over the elderly. The government argues they make up the bulk of the country's workforce. They're the breadwinners. Critics say the more vulnerable could lose out. Indonesia has topped 1 million coronavirus cases, and to clamp down on the soaring infectious rate, it's launched one of the world's biggest vaccine drives. But its strategy is contentious.
The first shot in Indonesia's national vaccination program, President Joko Widodo getting the jab to inspire confidence among citizens. But the plan is already controversial, as it prioritizes younger people over the elderly. Even influencers have been put at the front of the line. They include Risa Saraswati, a singer and writer who's been vaccinated since last week. Along with health protocols, vaccination is one of the best solutions to the pandemic. So I hope that with vaccination, people who lost hope last year due to inaction and neglect will regain their excitement and join the vaccination drive. But older people are less than joyous. The vaccine hasn't even been tested on them yet. Although recent data shows that people over 60 in Indonesia are nearly 20 times likelier to die of COVID-19 than young people. It's boring just staying at home. Hopefully the vaccine will be made available to the elderly soon. For now, I hope that apart from protecting themselves, the young people who have been vaccinated will also protect the elderly and children who have not been vaccinated. The government justifies its vaccination priorities largely on economic grounds. We see that the majority of these young people are those who carry out economic activities in supporting their families. They are actors in economic activities, so we prioritize those aged 18 to 59. Meanwhile, the elderly tend not to do activities outside the home because they are not the backbone of the family's economy. The vaccination scheme has sparked debate in the community. I do not agree. The reason is because the elderly are the ones who need it more. I agree because there is no vaccine for the elderly yet. I don't think I agree because the older ones are more vulnerable than young people. The health ministry says the elderly can expect to start being vaccinated in March or April, when the BioNTech Pfizer and AstraZeneca Oxford vaccines arrive.
So what happens to the elderly while they wait? What happens if they catch COVID? I posed that question to Dr. Harapan, who's based in Banda Aceh.
So they have to stay at home and keep the social distancing, and also if they have the catch the COVID-19, our healthcare system is ready to treat them.
I guess it's easier to keep an elderly person at home rather than a young person. But what makes you think this is the right strategy when the rest of the world is taking on a very different approach?
Because the number of vaccines that arrive in the first phase is very short, and also the number of the proportion of the elderly in Indonesia is low compared to other countries, and also we have the crisis in the healthcare system. Therefore, we have to keep our healthcare worker first.
We're already seeing case numbers fall in some countries as a result of their vaccination campaigns. Is your country already seeing results?
Not yet at all. Not yet at all. We just started vaccination around 1 week ago, and then we are and also the number is still a very small proportion. So we haven't see any any decrease of the number of the COVID-19 in Indonesia.
How much does logistics play a part here? I know it's very difficult to distribute the vaccine in Indonesia.
Right now, we have 3 million vaccination for healthcare workers, and then we have to put them with the provincial health office, and then from provincial health office will distribute to the hospital and also the puskesmas in Indonesia. It is a big task. It is a hard task.
And what about resistance among Indonesians? Is that a difficult task? I know Indonesia was the first outside of China to approve an emergency COVID-19 vaccine developed by the Chinese drug maker Sinovac, despite its low effectiveness. Does that worry people?
It is a big problem here in Indonesia. Is the hesitancy not also with the general population, but also healthcare workers. But this is the thing that the government should take attention and then try to decrease the resistance from the people of Indonesia.
And another factor that could see some resistance, what about halal vaccines because of your large Muslim population?
So the halal is a must in Indonesia, especially for the Muslims. So all the vaccine that we have to take should be passed with certification from the Muslim Council. So all the vaccines should have tested by this organization.
Dr. Harapan, thank you very much for joining us today. Picking up on the point of efficacy, all those numbers can be a little confusing. The team from our science desk decided to take a look at some of the rates and the history of vaccines.
So we've heard a lot about the efficacy rates of COVID-19 vaccines.
US pharma firm Moderna says its COVID-19 vaccine is 94.5% effective. Pfizer-BioNTech COVID-19 vaccine has an efficacy of 95% in final trials. Russia's Sputnik V coronavirus vaccine trial shows encouraging results.
But what does this mean in, the history of vaccines?
Let's explain. The first ever vaccine was for smallpox. It was introduced in 1796. The disease was then declared eradicated nearly 2 centuries later in 1980. And the vaccine was 95% effective in preventing smallpox.
Measles, 97% effective. But in spite of the strong vaccine, measles continues to spread.
Looking at you, anti-vaxxers.
Polio has nearly been eradicated, and the vaccine is 99% effective.
The flu vaccine is a tricky one, as the virus mutates regularly, so people have to get flu shots every year to help protect against the most common strains. Generally, the effectiveness of the flu shot hovers around 50 to 60%.
When scientists started work on COVID-19 vaccines, the World Health Organization said it would accept a vaccine efficacy of just 50%.
So, with these recent phase 3 clinical trial results showing vaccines that have north of 90% efficacy, we have lots to be hopeful about.
Well, yes, but...
I knew there'd be a but.
Just because the results have been good so far, that doesn't mean we can instantly go back to life as we knew it. Not everyone will be able to get vaccinated. That includes people whose immune systems are compromised or weakened by existing conditions. And it will take a while to get vaccines to everyone who can be vaccinated.
So, masks and social distancing are the way it's going to be for a while yet.
And now over to our science correspondent, Derek Williams. He's been looking into your questions on the coronavirus.
Is the British strain of COVID-19 really more deadly?
Last week, the British Prime Minister caused quite a stir when, at a press conference, he led with this.
In addition to spreading more quickly, it also now appears that there is some evidence that the new variant, the variant that was first identified in London and the southeast, may be associated with a higher degree of mortality.
The announcement was based on an assessment made by a group of scientists who advised the British government. They'd examined new studies and called the idea that the variant was more dangerous a realistic possibility. They even put a number on it, around 30 to 40% more deadly. To clarify what that means exactly, an official used the example of 60-year-old men. In those who today are infected with earlier versions of the virus, around 10 out of 1,000 60-year-old men die. If it were 30% more deadly, the new variant would kill 13 of those men. The thing is, a lot of experts, including the ones at the press conference, by the way, they've been reminding people that the estimate is still based on some pretty preliminary data and also horribly complex surrounding factors, not least the fact that, of course, we're pretty sure now the variant discovered in the UK is more transmissible than earlier ones. And of course, higher transmissibility will also lead to it killing more people, simply because more people will catch it. And perspective is also important. Even if the new variant does turn out to be somewhat more deadly, it's still unlikely to prove to be as lethal as the original virus was at this time last year, because back then we knew a lot less about how to treat COVID-19. Now we're able to save a lot more of the people who end up developing severe disease.